Hello, everyone, and welcome to the National Action Alliance for Patient and Workforce Safety National Webinar Series. Today, we will be focusing on advancing organizational safety strategies using the National Action Plan foundations. My name is Fran Griffin. I'm a consultant in patient safety and quality working with the Alliance, and I will be moderating today's session. Next slide, please. So a few housekeeping tips before we get started. Today's webinar will be recorded and available on the National Action Alliance website following the session. Please use the chat function throughout the session to engage with us. We'll be prompting you with some questions shortly, and you can use the chat to chat with each other and pose questions for the speakers. We will be taking questions at the end of all of the presentations today. Closed captioning is available using the instructions that you see on the screen. We have three excellent speakers lined up to share information with us today, particularly around the area of how to conduct self-assessments of your organization around patient safety. We'll be hearing from the National Action Plan, how the self-assessment tool was organized, and then we'll hear two examples of organizations who have used this assessment tool within their own local sites. Next slide, please. So we wanted to frame the webinar around two questions to run on and what we're thinking about today. And we're hoping that today's session will help you answer these questions and apply the safety self-assessment tool in your own organization and perhaps develop an action plan on your areas of opportunity. So the first question is, how can the self-assessment tool help organizations identify and prioritize areas to work on? And we'll hear a couple of examples from our speakers today. We also want to think about how are patient and family representatives best included in the self-assessment process, since their voices are absolutely critical. As we go through today's session, please think about these questions and type your responses into the chat to indicate your thoughts on how the safety self-assessment tool might help you and other organizations and how patient and family voices are best included in that process. Next slide, please. So our first engagement question for all of you today is, how have you assessed safety in your organization? We'd like you to type into the chat now, and please send to everyone so we can all see each other's responses. How have you assessed patient safety and workforce safety? Are you using the tool from the National Action Plan? Are you using other tools? We'd like to learn what everyone out there is using for this critical first step in understanding patient and workforce safety. So let's pause for a moment and see if some responses come in on how you are assessing. Great, and I see a few coming in already. Give it just a moment for people to type some responses in. Excellent, great. So while the responses continue to come in, I would like to introduce the first of our three speakers today, Patricia McGaffigan, Vice President from the Institute for Healthcare Improvement. Patricia is President of the Certification Board for Professionals in Patient Safety and Vice President of Safety at the Institute for Healthcare Improvement, where she is Senior Sponsor of IHI's Lucian Leap Institute and Co-Chair of the National Steering Committee for Patient Safety. Prior to the merger with IHI, she served as the Chief Operating Officer and Senior Vice President of Safety Programs at the National Patient Safety Foundation and in roles in clinical practice, academia, and the medical device industry. Patricia is a certified professional in patient safety, a graduate of the AHA NPSF Patient Safety Leadership Fellowship Program, an IHI Fellow, and serves on numerous national committees, task forces, technical expert panels, including the AHRQ Survey of Patient Safety Culture Technical Expert Panel and the Joint Commission Journal on Quality and Patient Safety Editorial Advisory Board. She is board member of the Massachusetts Coalition for the Prevention of Medical Errors, the Foundation to Advance Nursing in Massachusetts, the IPASS Institute, and serves on Plaintree's Person-Centered Certification Committee. Patricia is the recipient of the American Association of Critical Care Nurses Lifetime Member Award, the 2023 University of North Texas Health Science Center's Mary E. Lubell Distinguished Service Award, and named to the 2023 Becker's Review list of patient safety experts to know. Patricia received her BS in nursing from Boston College and her MS in nursing from Boston University. So welcome, Patricia. It's a pleasure to have you here today and to turn it over to you.
Thank you so much, Fran, and welcome to everyone who's joining us today. I have a small role in setting some context around AIM 1 of the National Action Alliance, and I'll specifically focus on some level setting around the National Action Plan. I see that there may be some folks who are already familiar with that in the audience, and for others, hopefully this will get you started on appreciation for what it's all about. And I'll follow this with my two wonderful colleagues who have actually been working on bringing the National Action Plan to life. So let's jump in with the next slide and begin with a little bit of history on the National Action Plan. And as Fran mentioned, after the merger between the National Patient Safety Foundation and the IHI, our board of directors at IHI made a really critical investment in convening a national steering committee for patient safety. And they chartered this group with the creation of what would become the first national action plan for patient safety in this country, developed through the collaboration and coordination of many organizations. The National Steering Committee, or as we refer to it, the NSC, was originally comprised of 27 member organizations, and they included diverse groups such as federal agencies, associations, accrediting bodies, patient and family advocates, and safety experts, to name a few. And we also established 4 subcommittees of similarly diverse representatives who served as subject matter experts for the 4 foundational areas of the National Action Plan, or NAP, as we refer to this. And those are in the upper right-hand portion of the slide, and I'll address those shortly. We originally planned to release the NAP in May of 2020 at our IHI Safety Congress, and you all know what happened at that time with the pandemic. So instead, we took a pause to evaluate whether the plan would remain viable amid a global pandemic, and we deemed that it in fact was viable and probably more relevant than ever. So we released the plan during World Patient Safety Day in September of 2020. And then as the pandemic progressed, we began to see what we had feared might happen, which were setbacks in safety performance. So in May of 2021, we released an urgent call to action in our declaration for leaders to take action on safety. In 2022, we brought together representatives from many of those organizations that took action, that had been using the NAP, to understand more about how they were implementing it. And we began to profile these users in webinars and conferences. And then at the end of 2022 and into 2023, our federal partners came together to establish the HHS National Action Alliance for Patient and Workforce Safety that Fran mentioned. And the first of the 5 aims of this focus area is on conducting an organizational assessment of safety and identifying and responding to opportunities for improvement. On the next slide, I just want to mention that when the NSC first came together, and if we can just move into, we're there already, thank you, I'm sorry. We discussed the importance of establishing principles for how we would operate, and you'll see some of those in the bottom of the slide. We committed to ensuring that our work was person-centered, that it would be relevant across the continuum of care, and that our commitment to health equity would be embedded in our work. We chose not to focus on any one specific healthcare-acquired condition, such as infections, because there had already been extensive resources that were available and applied to a lot of the work that we've done to improve performance in certain areas. And instead, we focused on what we might describe as organizational attributes and behaviors that are foundationally embedded in and associated with organizations that had stronger performance and safety. And those foundational areas are listed on the slide: culture, leadership, and governance, patient and family engagement, workforce safety and well-being, and the learning system. Let's move on to the next slide, where I describe the 3 components of the Safer Together National Action Plan and the guidance that we provided for this plan when it was originally launched and in the declaration that we issued a year later. And that centers around 3 components and 3 tasks. The first is to review the recommendations and tactics of the plan. The second is to identify a senior sponsor and a core team that are charged with deploying the organizational self-assessment tool to determine the current state. And the third is to set goals for improvement and enacting strategies and tactics and measurement and improvement plans, and leveraging the third component of the Safer Together kit, which is the implementation resource guide. These are all freely available on the IHI website. And if we move on into the next slide, we'll jump into a little bit of an overview of those 4 foundational areas where I describe the aims and the recommendations for each area. The aim for culture, leadership, and governance is to leverage the influence of leadership and governance bodies to commit to safety as a core value of the organization and to drive the creation of a strong organizational culture. And the recommendations for this area center on ensuring that safety is a demonstrated core value of the organization and leaders, assessing and committing resources to advance safety, widely sharing information about safety to promote transparency, and implementing competency-based governance and leadership. On the next slide, the aim for the patient and family engagement area is for organizations to institute strategies to improve safety, not only defined by the workforce, but also defined by patients, families, and care partners, and to do so in all settings across the care continuum. These include establishing competencies for all healthcare professionals in engagement of patients and families and care partners, engaging patients, families, and care partners in the co-production of care, including them in leadership, governance, and safety and improvement efforts, ensuring equitable engagement for all, and promoting a culture of trust and respect for patients, families, and care partners. The aim for the workforce safety and well-being foundational area on the next slide is for healthcare organizations across the continuum to implement strategies that measurably and equitably improve safety for healthcare professionals and all staff, everyone in the organization. And these recommendations center on implementing a systems approach to workforce safety and well-being, assuming accountability for physical and psychological safety, and for healthy work environments that foster joy and thriving of the healthcare workforce, and developing, resourcing, and executing on priority programs that equitably foster workforce safety. And for the fourth and final area of the National Action Plan, the aim of learning systems is for healthcare organization and other parties across the care continuum and the healthcare industry to implement reliable learning systems that actively engage with local, regional, state, or national learning systems, and to develop further networks that are necessary for advancing safety. And the recommendations for this area focus on learning within and across organizations, accelerating the development of safety learning networks, initiating and developing systems to facilitate interprofessional education and training on safety, developing shared goals for safety across the continuum of care, and expediting industry-wide coordination, collaboration, and coordination. And I think today is a great example of the intention of this foundational area as we look at the collaboration of the federal agencies in coming together to establish the National Action Alliance and their collaboration with the National Steering Committee and with healthcare delivery organizations and more. Now, if we move on to the next slide, Kelly and Melinda, who will follow me, will comment on what their own experiences have been with the Safer Together self-assessment process. And what you see on this slide here is a snapshot that aggregates scores of other organizations who have completed the self-assessment. So for each foundational area, there are scoring bands that fall into the categories of just beginning, making progress, significant impact, and exemplary performance. And when we aggregated the average scores from the 160 de-identified self-assessments that are on this slide, we found that the average scores for each domain fell into the making progress band, which is on this slide is a yellowish color. You might see it as orange on some other slides. And the lowest average scores, I just want to point out, because I think this is a super critical opportunity for improvement, is in the foundational area of patient and family engagement. And in many organizations not reflected in this data set, we see the same. So I wanted to share this slide because some folks have actually said, we've got to get better at safety before we take the safety self-assessment. And the point here is that we're going to see organizational performance that's all over the board in terms of these scoring bands and highly variable. So I invite you to not wait to think that you're getting better, because this is actually a tool that will help you get better. And I also want to emphasize that the intention of this effort and work around assessing where you're at is not to score for judgment. It's to identify important opportunities to focus improvement. And again, you'll hear that come to life. On the next slide, I just want to give you an example of that last point that I made. The left-hand column, you see the foundational areas of the National Action Plan, and you see from the data set that I just shared with you what the highest scoring and lowest scoring elements were in each of the domains. So for example, in culture, leadership, and governance, there are multiple elements in that self-assessment tool that are related to this foundational area, such as harm events, whether annual reviews and job descriptions for senior leaders incorporate safety, and more. And the highest scoring element in this band was around how harm events are reviewed and communicated and evaluated, and lowest for the incorporation of safety performance in the annual review of senior leaders. In the patient and family engagement area, the highest scoring element for this group was related to communication and resolution of adverse events, while scores for patient and family advisory committees and inclusions of patients and family members on the organization's overall committees were lowest. For workforce safety, the highest scores were the availability of safety reporting systems and characteristics of those systems, while the lowest scoring element was whether workforce safety is embedded in the job description of senior leaders. And finally, for the learning system, establishing safety goals was the highest scoring element, while engaging patients in the co-design of safe systems, moving beyond their own care into the co-design of safe systems, was the lowest scoring element. And in the organizational self-assessment, regardless of where you might score, and even if your organization was to have exemplary performance across all 4 foundational areas, there are suggestions that are offered for how to continuously improve. And that's the spirit and the intention of this work. On my final slide, I wanted to just pause for a minute with a slight pivot. I'm not sure how many of you have heard of the proposed CMS patient safety structural measure for hospitals. It's currently available in the Federal Register, and public comments are open until June 10th. But I wanted to give you a little bit of background on this measure because it's highly aligned with what we're talking about today. So structural measures, little bit different from quality measures, assess features of healthcare organizations relevant to its capacity to provide good care. So the focus of this patient safety structural measure is on whether hospitals demonstrate a structure, culture, and leadership commitment that prioritizes safety at a very high level. That's a nutshell description of this. It's an attestation-based measure, so hospitals would evaluate and determine whether they can affirmatively attest to specific elements of each domain that are specified in the proposed measure. And those are listed in the left-hand column. In the far right-hand column are some of the specifications for each domain. And I wanted to call out as one example, domain 1, which is on leadership commitment to eliminating preventable harm. And one of the key specifications for this domain on the far right-hand side is whether the C-suite oversees a safety self-assessment and a resulting plan and metrics. So this is highly aligned with what the National Steering Committee deemed important and created a tool for in the National Action Plan. It's also highly aligned with the AIM 1 that we're talking about today, the aim of the National Action Alliance, which is on organizational self-assessment and improvements. And what I've added to this slide in the middle, and thanks to my colleagues at AHRQ for creating this slide, is a crosswalk of the foundational areas of the National Action Plan to further illustrate the alignment that I believe is highly reflective of many years of coordination and collaboration and public-private partnerships of the many entities that have come together to unify our voices and point attention to the critical and often untapped foundational instructional areas that we know are necessary for transforming safety into a durable, reliable property of healthcare organizations. And with that, I'm complete, and thank you for your attention, and back to you, Fran.
Great. Thanks so much, Patricia. That was incredibly informative. And I just want to reiterate your comments about using the tool. When I think back to 25 years ago when To Err Is Human came out, we didn't have a tool like this. And so we didn't have any way to measure our patient safety. And we weren't even talking about workforce safety enough. So it's an incredible tool that everyone should take advantage of. And I agree with you that they don't have to know where they are. I mean, they don't have to get better first, because no matter where they are, everybody's got a peer. When I looked at that one slide where you showed that every box had numbers in it, everybody's got a peer. So nobody should be worried about being in the bottom all by themselves, because chances are they won't be in the bottom. And no matter where they are, they have peers. And as you said, the key is learning, so then they can find out who's doing well and learn from them by adopting strategies that others have already figured out, which is, of course, a great segue to where we're going next. So thank you again so much, Patricia. It's my pleasure to next introduce Kelly Randall, Vice President of Patient Safety and Compliance and Clinical Operations at Ascension, where she specializes in patient safety and quality improvement program development with an intense focus on applying tactical, high reliability strategies to sustain improvement and drive toward zero events of harm for patients. Previously, she worked as an associate vice president for regulatory services at the University of Alabama, as well as director of quality and safety for Sacred Heart Health System. Dr. Randall received her PhD in Health Services Administration from the University of Alabama at Birmingham and her MPH from the University of Alabama. So welcome, Kelly. We're thrilled to have you here today and looking forward to learning how you actually use this tool in your organization. So over to you.
Thank you so much, Fran, and thank you to everybody on the call today for taking time out of your busy day to hear more about the National Action Plan and how it's being used across a couple of different organizations. You'll go to the next slide for me. So as Fran mentioned, I am the Vice President of Patient Safety and Compliance for Ascension Health, which is a fairly large health system with slightly over 2,600 sites of care located within 19 states in the District of Columbia here in the US. We initiated our journey with the National Action Plan at a time back coming out of the COVID pandemic, where we were relatively complacent with our patient safety program. And we were really struggling with reconnecting our safety culture on the front lines. The COVID pandemic, as we all know, created massive disruption in our care environment. And at that time, we were really focused on reacting to patient safety events that were occurring, as well as trying to move more into that proactive space by amplifying high reliability practices across the care continuum in all of our organizations. And at that time is when we saw the republication of the National Action Plan and thought this would be a great opportunity for us to administer the self-assessment across our organizations, because what the National Action Plan did was provide a beautiful framework with tactical operational recommendations for improvement, really helping us look at our structure for patient safety improvement across the care continuum. So we embarked upon a journey to do the self-assessment with each of what we call ministry markets. So essentially a ministry market in Ascension is a grouping of sites within a state, if you will. We are a faith-based organization, so hence the term ministry market, and really establish what our baseline was. You'll go to the next slide for me, please. What you'll see here is, for us, it was really important as we embarked on this journey that this not be another initiative. So I hear all the time from associates across Ascension, well, what is this related to? Is this related to value-based purchasing? Is it related to high reliability? Is it related to hacks? Is it related to insert any other program that all of you guys are working through, right? Creating quite a chaotic environment for our care providers. So when we took a look at what that meant for us in Ascension, we have a framework, the graphic represented on the left-hand side of this slide, for our patient safety program. Healthcare that is safe, in the middle representing our overarching goal to heal with harm, to eliminating preventable harm across our healthcare system. grounded in the 5 principles of high reliability, and then some particular elements of that program make up our program on that outer green circle. What we inserted into this graphic as we took on this journey was that blue bar in the center that said we not only need to ground our program in high reliability theory, but we also need to ground it in the 4 foundational elements of the National Action Plan. So as we think of things that we're working on or initiatives that we're doing in each of these 4 elements of our program, how are they reflective of not only our high reliability principles, but which aspect of the National Action Plan foundational areas do they address? That way, we can ensure that we have one strategy from a patient safety program, and we're really using the work that we're doing to transform who we are and how we work so that it is sustainable over time. On the next slide, you'll see a bit of a depiction. My brain thinks in pictures a lot of times, and so you'll see a depiction of what this looks like as we filter down across those different pieces of that framework for us. So obviously at the top is healing without harm, which for us is zero preventable harm, has been our goal in Ascension since 2002, grounded in high reliability. And you see, as you filter down in this graphic, you see our principles of high reliability, the foundational areas of the National Action Plan, and then the pieces of this graphic that are new is those tactics that we are working on. What are the practices that we are applying across the continuum of care in all of Ascension that are going to drive us to that zero preventable harm when implemented in a consistent and sustainable manner? Next slide. So when we did the self-assessment initially, we did the self-assessment as a group discussion exercise. So in each of our 12 ministry markets, we pulled executives together to the table that were representative of all of the sites of care within that particular market, as well as all of the continuum of care in that market. So all voices were heard, and we had a conversation about each of the foundational areas and walked through the self-assessment. For us in this conversation, it was really important that we established ground rules. This is very focused on learning. We wanted to know why we were scoring the way that we were scoring, more so really and truly than what that score was. It was that qualitative data that was going to be really important for us to understand where we had opportunities to improve. We worked in that conversation to establish consensus among the group. So facilitation was really important as we strive to maintain a psychologically safe conversation during that time. And I would say in that assessment, it was important for us to pay attention to the variation that was happening around the table. So if we had one person at the table who was kind of saying, yeah, we're really a 1 in this area, or we had another group or person saying we're a 4, we really needed to understand why that variation was occurring and what were the perceptions that were contributing to that variation. So make sure as you take the assessment or you administer the assessment, being able to capture that variation is probably more important than your average score for that particular element. So you'll see our scores on the right-hand side of this. I took a very deep breath when I presented these to our board for the first time. We were a lot lower than we really thought that we might be coming in. We had some opportunities in our structure that we needed to really take a look at and improve on in order to drive sustained results over time in our patient safety program. Next slide. So we took the opportunity from that first assessment to say, okay, what are our strengths, weaknesses, opportunities, and threats as we look at prioritizing how we improve? And so you'll note there were many things from this self-assessment that we had conversations about that we did really well. We have a very strong reporting culture from an incident reporting perspective, very strong guidelines from a root cause analysis perspective. So we know that those are being done in a structured manner. And then we utilize the Ascension Health Patient Safety Organization in many, many ways around all teach, all learn, sharing lessons learned, really truly being that learning system across our organization. But along with those strengths came some weaknesses and opportunities. And so for us, it was really thinking about how are we moving into that safety 2 work? How are we looking at being proactive? What does that standard work look like for our patients and families? We uncovered some inconsistencies and some lack of understanding, if you will, around just culture. So we had an opportunity to really ensure that when we say the words just culture, it has the same meaning for every associate within our organization. And then for us, patient and family engagement was definitely an area of opportunity. You see that here in the weaknesses slide. With all of this, lots of threats to the healthcare environment. So we wanted to be sure we had those listed out so that we fully understood how we understand those, so we can anticipate bumps along our journey and threats to the improvements that we are making. So on the next slide, within the 4 foundational areas, I'll just quickly cover a few of the highlights within our organization and what some of our goals look like. So with culture, leadership, and governance, what we heard was that while we understood all of the work that was happening in quality and patient safety across Ascension at the executive leader level, and some significant improvements that we're making and wonderful wins, that messaging wasn't really translating down into our middle level of management or our front line. So we took quite the pause and said, you know, first, before we dive into a bunch of improvement work, let's take time to celebrate the work that we're doing and really bring our associates in to that with intentional communication and messaging. We did some education around quality and safety for our board. So not our quality committee of the board, as they are all incredibly competent in quality and safety, but our big board, if you will. We spent an hour with them to say, here are some of the priorities and some of the things that we really want you to look at as we talk about quality and safety with you. Let us help make sure that you understand what those are so that you can meaningfully contribute to holding us accountable to achieve the results that you do. We also focused a significant bit around accountability. And we did this in many different ways. How are we holding ourselves and the up and down direction accountable for the safety goals that we have? I put a picture here of our quality, the header for our Quality and Safety Matters newsletter. I'm super excited to say that as a result of some of this work and conversations we've had, since October, we have been sending a bi-weekly newsletter to every associate across the Ascension organization around quality and patient safety. That is a first for us and was a huge win for our organization, and our associates have voiced how appreciative they are to see that communication and learn about what is happening across our organization. On the next slide, in the patient, family, and workforce safety, you'll see that in 2022, we were in the orange, so in that making progress range. Our projection, we're in the process of doing the second self-assessment for our organization now, so you'll see some movement here as a result of some of the opportunities and focus areas. So we have built associate safety in alignment with our STEEP framework for quality and safety. So as we think about safe, timely, effective, equitable, patient-centered, how are we building associate safety into each of those pieces of quality and patient safety? We also took time to say, you know what, we don't want to benchmark ourselves against other healthcare industries. We know that healthcare is not a safe industry by and large. So we are benchmarking our organization against non-healthcare targets, specifically construction. And then we've taken a significant amount of time to say, how do we align how we respond to associate safety events in the same way that we respond to patient safety events? So the responses are now no different. Our associate health professionals are trained in the Ascension Causal Analysis Program. That data is integrated so that we can look at common causes across patient and associate events, and we include our associate health professionals in our All Teach, All Learn programming. On the next slide, in the area of patient and family engagement, we had quite significant opportunities with this. I'm sure, like many of you during the COVID pandemic, we sent our patients and our families home, so we sunset our patient and family advisory councils. And so while we are projected to make some improvement in this area, we have significant work to do. We have been focusing on patient and family digital panels, so not your traditional patient and family advisory council, but how do we engage differently in a digital manner with patients to get their feedback on certain initiatives or things we have going on. And there's been a significant focus on health equity in Ascension. So we've recently created the Ascension Foundation for Health Equity. We have over 600 CHNA community health needs assessments and action plans that are underway. And then we have worked to really support our markets in understanding equity reports by zip code of the patient population that they serve. On the right-hand side, you see two graphics on the bottom. Our service commitments were developed specifically with not only a consumer experience focus in mind, but as well patient safety. So in each of these three service commitments, you will, if you dive into the layer below, you will see our high reliability safety behaviors that are referenced within. On the next slide, I will quickly talk about our learning systems and some of the things that we are doing there. We are leveraging use of the Ascension Health Patient Safety Organization pretty significantly. We have monthly safe table conversations across the organization where we're sharing in detail root cause analyses on safety events that have occurred. What has been so beautiful about the conversation in these groups, which kind of happened organically, was not only are our patient safety and leadership that are presenting the root cause teaching others, but through that conversation, other organizations are teaching that organization that had the event. So there's been really nice bidirectional communication there. And then we recently started a high reliability spotlight series, which essentially is a grouping of webinars that focuses on how we're improving safety culture across the Ascension organization by spotlighting organizations that have really seen significant improvement in culture through amplification of a high reliability practice. So our most recent was around leadership safety rounds and some of the learnings there. And then obviously we do participate in numerous external engagements. Next slide. So I am thrilled to say that our focus around patient safety and quality across Ascension has really led to some significant results. We've been able to amplify high reliability and safety, focusing on psychological safety through a campaign that we call We've Got Your Back, which is very focused on teamwork. And you'll see some of the results here on the right-hand side. So our voluntary reporting of near miss and no harm events has rebounded. Those took a significant decrease in and out of the COVID pandemic. We are seeing a decrease in serious safety events, a 20% reduction in healthcare associated infections. And then it's really neat to see for us, every single one of our quality and safety goals is stratified by an equity factor of some sort. And so in that proactive bucket, if you will, a focus on Medicare annual wellness visits, and you'll see a 20% increase overall, as well as a 16.5% increase specifically in the Black African American population. So these are a few of the results that we're seeing that we're really excited about across the Ascension organization. And we know that we'll continue to see better results through the work that we're doing. And finally, on the last slide that I have this morning, a few milestones of our journey and just kind of lessons learned, if you will, from us as we've undertaken this work so far. First, I would say walk, don't run. It's really easy as overachievers, which every single one of us as an executive leader is, to say we want to be all fours, all green. And certainly we had that reaction in Ascension. However, this isn't a perfunctory checkbox exercise, right? We really want the work we're doing to transform who we are. And so we are intentionally going a bit slower. Anticipate the bumps and make sure you have strong change management programs in place. I'm sure many of you are aware from the news, Ascension is having quite the bump right now with the cyber attack that we are undertaking. But I will tell you, our teams are incredibly resilient. And I do believe a lot of that has to do with the significant work that we have been doing around culture of safety, high reliability, and driving resilience. And then as you think about the work that you're going to do, be sure that you really focus on down a median, structure, process, outcome, but don't forget about accountability and sustainability, right? We really want this to be about how we sustain the results moving forward so we can continue to drive towards zero. That accountability and sustainability piece has been quite key for us in the Ascension journey. And then I just included on the bottom right-hand side here our anticipated results for this round of survey. So far, as we've worked through this, we are seeing these anticipated projected results come to life through the actual scores from our executive teams across the Ascension organization. We're excited to continue to see that come in as we wrap up our second self-assessment with the National Action Plan. And with that, Fran, I will turn it back to you.
Great. Thank you so much, Kelly. And congratulations on the results that you are seeing to date. That is really awesome. I'm so glad you mentioned when you talked about using the tool that it should be a group exercise, because with these type of tools, that is absolutely critical. If one person or one department completes the tool, you get the perspective of one person or one department, and that variation is just a gold mine of learning opportunities, because it shows where there are communication opportunities or process opportunities, and it can really lead to some great improvements. So that's really fantastic. I also applaud you for sharing your results, even though the results when you first did this were not what you had hoped for. Although that had to be a little scary, it shows that you can do that and survive. You're still here. So for anybody out there who's hesitant to do the survey or complete the self-assessment tool because the results might not be great, Kelly is a testament to the fact that you can do it and survive and then improve. Because if you hadn't found out those numbers, you wouldn't now know where your improvements are. So great job. All right. Our next presenter, as we round out our hour today, is Melinda Sawyer, Vice President and Chief Quality and Patient Safety Officer from United Health Group. Dr. Sawyer, in her role, is responsible for developing and driving a highly reliable system for patients, clinicians, and payers by eliminating preventable harm and achieving optimal clinical quality outcomes for the 152 million people United Health Group serves. She has led quality and patient safety improvements at the national and international level, and currently serves as a technical expert to advise the 38 member countries of the Cooperation and Development to advance the benchmarking of safety culture data globally. Melinda has a doctoral degree in public health in healthcare leadership and management from the Johns Hopkins University, Bloomberg School of Public Health, and is a board-certified clinical nurse specialist. She holds faculty appointments in the Johns Hopkins University School of Medicine, School of Public Health, and School of Nursing. Welcome, Melinda. Great to have you here today, and I will turn the mic over to you.
Thanks, Fran, and thanks everybody for the opportunity to share our journey on our National Action Plan work. So next slide. So in United Health Group, we are, as Fran mentioned, a very large healthcare organization. We have approximately 440,000 employees, and we serve approximately a little over 150 million people, and we have the honor to serve them. But just for clarity, United Health Group has two main companies: United Health Care, which is a traditional in the United States, that payer space. But outside of the United States and United Healthcare, we actually also have care delivery services, including about 30 hospitals, over 100 ambulatory services, care clinics in 3 countries outside of the United States. And then the other half of our United Health Group is Optum, where we serve about 150 million individuals. We're in all 50 states. We have primary care, surgical care, behavioral care, specialty care centers, home care, behavioral health benefits, preventive care. And then we also have Optum Rx, which is a large pharmacy care services company. They serve about 61 million members, and we fill about 1.4 billion prescriptions each year. We're like Kelly, a very large organization. And next slide, as we advance towards our goal to become more highly reliable, we set a goal very boldly to eliminate harm and achieve optimal clinical quality for those we serve. And we knew we had to be holistic and comprehensive in our strategy. And so we developed an operating management system based on kind of high reliability principles. And that operating management system includes these 5 pillars. So great governance, leadership, and accountability. So we want to have focused oversight for quality and safety across all levels of the organization, from board to bedside. We want to have great learning systems so that we can anticipate and mitigate risks before they occur. We want to have wonderful capacity and infrastructure, so we need to develop and support an engaged, accountable, and continuously improving workforce. We need to have great communication and teamwork to foster open dialogue among leaders, staff, patients, members, and their families. And then finally, insights and innovation. We need to embrace new technologies to eliminate harm and achieve optimal clinical quality. So next slide. So when we were deepening that focus on quality and patient safety, we really didn't need to look any further than the Safer Together National Action Plan because of the collaboration across all of the national organizations, all the federal agencies and patient advocacy groups. We felt very strongly that that work that the National Action Plan Safer Together group did and the steering committee did to bring those organizations together to come up with these recommendations, we felt that was a very, very strong and compelling source of truth, if you will, for the work we needed to do. And we knew, and we wanted to recognize that in United Health Group, there were very diverse business. There were businesses, pockets of the businesses that might be doing things great, and other parts of the business in this National Action Plan that maybe needed opportunity, that had opportunities to improve. And so we thought using the National Action Plan would help us really assess our current state, leverage the best practices that were out there and already occurring, and allow us to prioritize our areas of focus with the evidence-based recommendation to improve, and then set out that goal to measure and monitor the improvement, as well as repeat this assessment every 24 months. And so I'm going to go a little bit into our journey and how we did this. So next slide. So we actually identified the National Action Plan self-assessment tool. It was selected for strategic priority in Q2 of 2022. And we, because of our strategic planning process, we identified it then for 2023's priority. We then hosted a quality and patient safety summit for implementation planning. And we actually piloted it in a couple of our areas, different areas of our business, so that those pilots could come back and inform the summit and help inform how we wanted to structure and operationalize this. So it was a great opportunity to try it out. Here's some lessons, and then implement those. And for us, given how big we are and how diverse we are, we spent Q4 2022 developing all the materials we wanted to use, including all the walking decks for leader socialization to make it simple and consistent up and down the chain. We built facilitator guides. We aligned on definitions and required variations. So in the payer space versus care delivery space, they might do something similar, but they use different terms. And it was really important that when they were using the self-assessment, that the terms, we worked through those differences and allowed for some just simple variation, like using the term member instead of patient. Just same idea, just in different businesses. And that went a long way to ensuring that everybody understood how to complete it and what to think about when they were completing the survey. So in Q1 of 2023, we actually required each of our businesses to tell us how many assessments to complete so that we could then work to train the facilitators and develop the data collection tool. It was really important to do that. I'll talk about that in a little while, because as Fran mentioned, and as Kelly mentioned, getting to a level of survey into the business where we could detect differences, but not be overly redundant. So if we have, 3,000 ambulatory clinics, we didn't need to survey each ambulatory clinic, but there might be parts of the business that were pretty different. And so we needed to figure that out. And we really left that up to each business. We completed the assessment in Q2 of 2023. We then spent a full quarter looking at the results up and down our business and thinking about what should we take on at the enterprise level, which is where I am, versus what should we really let each business drive in their business specific action plans. And so it was a lot of iterative discussions to see what really should we be taking on at this highest level so that everybody could benefit versus allowing that the differences and customization within each business. So that was a full quarter of work. We then developed both enterprise level and business specific action plans. And then we report out on those action plan, what we have the implementation going on in 2024. And then we have reporting up to the enterprise on all of the action plans moving forward. Okay, keep moving forward. All right, so I'm going to go through these a little bit more quick. We completed 64 assessments in Optum and 57 assessments in UHC. And you can see that breakdown, but in total, we completed 121 assessments across our enterprise. This was, again, really because there were so many different, we have such different businesses across our enterprise. Next slide. And then what we did at the enterprise level, again, that iterative process was we identified some key areas of focus for us to take on at the enterprise level. We wanted to take on safety culture survey, safety goals, job descriptions, and then in workforce safety, both the safety strategy and occupational safety, as well as learning and competencies. So I'm going to just cover off on a couple of these in the next slide, and we will just to highlight some of the work we did. So again, if you take safety culture surveys, you can see here, we were really, we had some areas of the unit of our hospital, of our business doing these really well, and other areas where it was neither required nor had been done. And so we decided that safety culture was so important across our enterprise, we were going to take on the measurement across our enterprise. And so this survey, this self-assessment really helped us as we were designing it to shoot for a 4, because if we were coming out of the gate, we might as well try to shoot for a 4. So next slide. So here's some examples of what we did. We just completed our first enterprise-wide safety culture measurement in October 2023. We used 5 different surveys because of the diversity of our business, and we achieved a 61% response rate. And at that time, we had 409,000 employees that were surveyed. We'll do this every 2 years moving forward. But some of the interesting things we got to do to help us score that 4 and help guide us and to build this the right way the first time is we're now able to track and trend and drill down to every level of the organization, all the way down to the individual teams. We did and have completed domain and item analysis. And just like we have a commitment to health equity across all of the survey, we take that also for our own employees. So we did race, ethnicity, and gender analysis to understand differences in perceptions of safety culture. And so I'd be curious if you're in the chat, everybody wouldn't mind putting in the chat, have you ever done race, ethnicity, gender analysis for safety culture in addition to your employees? So I'd love to see what folks' responses are to that. We did qualitative analysis for our 65,000 comments, and we've developed hot spots, warm spots, and bright spots for quantitative and qualitative. Also, really interestingly, debriefing and action planning was really important to score that 4. So we have action planning built into the survey platform. We're allowing for action plans to be viewed by all managers. We have 26,000 managers. And what we did, because we didn't want the 26,000 managers going out to have to look up evidence-based interventions to improve measures. So we incorporated AHRQ's evidence-based recommendations into their pre-populated action plan. So they could opt out of it, but if they wanted to look at the evidence-based interventions, that came in with them already. And then we have business level action plans submitted every 6 months on safety culture work. Next slide. I know we only have a few minutes. So safety goals, this was a big one that you heard about, and it's both in learning systems and culture, leadership, and governance. Next slide. So again, we wanted to get as close to the 4 as we could. So in October 2023, we launched a new aligned quality belief. We incorporated quality into our values of an organization, and we did a stop the clock week, which was a big effort in an organization our size. In December, we launched our revised quality and safety dashboard to drive towards high reliability. You can see this includes the completion of the National Action Plan. We've set bold, specific target setting guidance for all of our dashboard measures. You can see here the domains of quality on the left for our quality metrics, and on this for our safety metrics, we use these 4 domains of safety from the National Action Plan self-assessment tool, and it's embedded at the bottom. You can see our high reliability principles. Next slide. And then finally, in January, we actually launched job quality and safety goals by business with measurement by objectives or MBOs to measure the progress. And we also launched quality and safety goals in the annual performance reviews for all of our employees. So great, a lot of work there, but some of the action we're taking to close some of those to get to that 4 score. Next slide. Here's an example of the deepening our quality belief. Next slide. We went, and just to give you an example, how we've incorporated quality into our mission and values of our organization. Next slide. And then some of the topics we covered during Stop the Clock, the Stop the Clock week. So we did a full knowledge day. We had 2 days of discussions, and then we did a thank you Thursday, just where we really got to kind of share the stories of the week. Next slide. And then finally, learning systems, education, and competencies. Again, we're working on this now. Next slide. We've launched a quality academy in April 2024 for our entire enterprise. We launched the first course called Quality in Action. Think of it as like a quality and safety 101 course. And it went out to all employees and our new hires. Later this year, we're launching a core problem solving courses for all employees, and then a very specific clinical facing employee 201 level course. And we'll build off the kind of build 301 and 401 courses for clinical quality leaders also. Next slide. These were, I'm not going to spend too much time on this other than to really just say these were for each of the phases of completing the National Action Plan self-assessment. Whether it's planning and pre-work, implementation, reporting and analysis, and action planning and implementation, these were some of our strengths in the work we did, and then also some of the improvements as we've debriefed and try to learn how to do this better in the future. And then we'll be planning a reassessment for next year, 2025. So Kelly's a little further ahead than us, but in that she's in the process of reassessing, and we'll do that again to see the impact of our improvements. Next slide. And then in summary, right, this is a great tool for us as a very large and diverse organization to assess our current state, leverage our best practices, help us focus and prioritize our areas of improvement, and then measure and monitor that improvement. And, you know, for us, we are a very diverse organization that includes kind of hospitals, ambulatory clinics, behavioral health, urgent care, pharmacies, pharmacy benefits, and payer. And this was an important tool for us in helping understand where we are and where we need to improve, both within the businesses as well as kind of across our businesses. And so this was really important work for us to help us move forward in quality and patient safety. Thank you, Fran. Thanks everybody for the opportunity to allow us to kind of present our journey. We're really interested in learning from others. And so get to learn, look forward to learning from each of you in the future as you engage in this work. So I'll hand it back over to Fran.
Great. Thanks so much, Melinda, and thanks for fitting that all in within our tight schedule today. The recording and the slides will be available following today, so people will be able to read through in closer detail. It's really great to see the patient and safety and workforce safety, not just in hospitals as a discussion anymore, but really being discussed across the continuum, which is the only way we're going to get there at a major level at all of the places that patients have touch points. So thank you so much for sharing that. We've got just a couple of minutes left and a few things to share. Before we do that, I'd like to ask all of the participants to please type into the chat, what's one action that you will take in the next week based on something you heard today from Patricia, Kelly, or Melinda? And if you have questions, you may put them in the chat as well. We obviously don't have time to answer them in the session, but we will use your questions to send out follow-up messages and share future content. So we'd really like to see in the chat, please share with everyone one action that you will take in the next week. And for our speakers, if there's a one recommended action that you would suggest to people that they start with, perhaps you could share that in the chat as well. Let's go to the next slide, please, while people are typing in all of their responses. There is another event coming up this week that we thought you might be interested in, so sharing information on that. This Thursday, May 23rd, there will be a webcast on AHRQ's hospital survey and workplace safety item set. Registration and information is available on the AHRQ website, so we encourage any of you who are interested to check that out. Next slide, please. So thank you all for attending today. This is one in our monthly series, as you know. So our next National Action Alliance monthly webinar will be held on June 18th, same time, noon Eastern, and we will be focusing on aim number 2 from the Action Alliance, which is understanding and operationalizing the patient voice. And that will be a key part of what we'll be talking about next month. Registration is available for that webinar. So actually, it should say on the slide, empowering the patient voice in the safety strategy. So apologies for that being missing on the slide here. We do encourage you to join us. And again, these will all be recorded for your availability and others. As a reminder, you can also stay connected through the NAA Listserv monthly bulletin, or you can email the Alliance team at any time. So thank you again to our 3 presenters today for their outstanding results and information. Thank you, Patricia, Kelly, and Melinda. Thanks to all of you for being here with us today. I'm looking forward to reading all of your chat messages, as I'm sure are every member of our team and our speakers. Thanks, everyone. Have a great and safe day.